Hello and welcome. I'm Dr. John Stracks. I'm a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. I'm here today with Linda Elarde. Linda is a special education paraprofessional and began experiencing chronic pain about 15 years ago, around 2008. And she was working in the conventional medical system for diagnosis and treatment, but knew that something else was going on too, and eventually discovered mind-body healing methods. And from there, over time, has gotten substantially better. And I want her here today to be able to talk about how that happened. And just one note before we get started, if you'd like to learn more about my practice and the people who work with me, please visit our website at cormendyhealth.com. Linda, thank you so much for being here with me.
Well, thank you for having me.
You are welcome. So let's start by just orienting people who are listening. So I mentioned it's been, about 15 years since the symptoms really started to develop. So can you tell people sort of what happened and what you noticed and what things were like back then for you?
Sure, I'll try to kind of condense that into a bit of a nutshell. I started experiencing severe lower leg pain in my right leg on the outside of my leg. And it would kind of come and go, but it would get very severe at certain times of the day or in the evening, like extremely severe. It felt like on a scale of 1 to 10, I remember telling you it felt like 100,000, just really knocked me out of the park.
That's pretty severe, 100,000.
Yeah, it was severe. It was, and you did point out to me at one point I had a tendency to somewhat have hyperbolic language, so that was helpful because I did. So that helped in the process of kind of calming it down. But that's where it started, and I went to my doctor after it just kind of persisted for several weeks, and I started feeling alarmed. So the fear started coming up, and I went to my doctor, and he said, "Oh, it sounds like maybe you have a little bit of sciatica. I'm going to give you extra strength, whatever, a pain med. I think it was an NSAID. And take it for 10 days, every day, 4 times a day, and then let me know how you're doing." Well, it didn't do anything. It didn't do anything at all. In fact, it felt like it was getting worse. And I got back to him, and he had me come in again, and he recommended that I try gabapentin. So I went on gabapentin for a period of time, and I did not see any improvement with that. And he said, well, the next step would be an MRI, and then maybe we'll send you to a doctor who was a colleague of his who was the spine specialist. And that felt like jumping from A to Z really quickly. Like, I just have some pain in my lower leg, even though it's severe. Like, I was fine before this thing kicked in. So it was very kind of shocking to me, that transition from spine specialist. So I started asking around, and I ended up finding a acupuncturist chiropractor through a referral from a colleague who's in my neighborhood. And I went to them, and I had acupuncture and other treatments from them, and I did improve, but it took a year. And he said, I think it's going to take a while to resolve this. And so ultimately I did have success after a year of treatment, going once a week, then once every 2 weeks, then once a month, then starting an exercise regimen. And looking back on it through a mind-body lens, I'm pretty sure that what was so effective in his treatment, because I had tried one acupuncture prior to him, and it was not a good experience. That acupuncturist and I did not jive. I think I just felt very safe. He had a very welcoming, kind of non-alarmist approach, and he was very confident that if I just could relax and go with the process, that I would be fine. but I needed to be patient and just take it day by day. And I think that was almost a mind-body way of thinking about it, because he stopped me from being outcome independent, from being focused on when will I be better, and just show up for your appointments and we'll just do our thing and you relax.
And so he stopped you from being outcome dependent, thinking
Right.
like you're gonna get better.
Right.
And then you lost that expectation that is, you thought, okay, he's letting me know that I can kind of go and see what happens and go over time. And, a lot of people who are listening know that so much about pain and symptoms is about finding safety. And that's why, people ask me regularly, do they need to stop any non-psychological treatment? But there are a lot of practitioners out there who are very safe people and very useful in our treatment plans. And so, and I'm all for people getting better no matter how they get there. And so that, I think, worked really well for a long time for you. I think you told me it didn't last forever though, right? You had a lot of relief, but then started getting worse again.
Right. I did have relief, and it lasted for, I want to say, a year and a half, 2 years. But I started having other pain. It shifted, which is also kind of a sign there, but I didn't know it at the time. It shifted to my hip flexors. So when I would walk, I would feel the stabbing pain in my hip flexor. And I went back to him, and his wife would treat me for my hip flexor. And then when I left, I'd feel better because they made me feel safe. And they were so kind and confident. They played nice music. They had these lovely rooms. Each room was a different, like an earth sign or water sign, or it was just so calming. Did not feel like a medical experience. It felt like a spa. And so that went on for a while, and I saw improvement after I'd see her, but it would always come back. And then ultimately it came back with a vengeance. And I couldn't even stand up straight. I was really, I think they call it shopping cart syndrome. Sciatica, where leaning on a shopping cart gives you relief because you're bending your spine. And so I did go back to my doctor then, because I was starting to feel alarmed why it was shooting down the back of my legs and I couldn't stand up straight. I had no pain in my back. It was always in my legs.
And do you have a sense of around when this was? We're talking like 2016, 2017, somewhere in there?
Yeah, I want to say, yes, it was probably around 2016. In 2015, I was dealing with the hip flexors, but it was not really, it wasn't severe enough to be impacting my life, and it was kind of intermittent. But it started to get chronic, and it started spreading and showing up in other places. And then it became very chronic in going down the backs of my legs and my glutes, and that got pretty intense. I would say for a year. I did not sleep through the night. It woke me every night, and I would be in excruciating pain. And I just didn't know what to do about it.
And so what did you like? What was recommended? What was tried? Did they send you for imaging, MRIs? Did they try epidurals? What kind of, how did that course go?
I actually did all of that. I ended up, I tried, they put me on tramadol, which I took, I think, one day, and then I said, no, thanks. First of all, it didn't do anything for the pain. It just made me feel really loopy and like out of body. Was not a good feeling. So I didn't do that, but I was taking 2 Aleve and 2 extra strength Tylenol every single day for probably a year and a half. Not good. But in order to function. So I went to the doctor. He did refer me to the spine surgeon. The spine surgeon did some evaluations of me. He said, I don't think that you're at a point where I would recommend surgery. He said, let's try physical therapy, which I appreciated that he didn't jump right to that. So I ended up having like 3 rounds of physical therapy that were like 10 weeks each, with different types of treatment modalities, and none of those worked. I did not get relief. One PT told me, she said, you're so hunched forward that your bottom rib is actually almost leaning on your hip bone. Like I could not straighten up. And so she said, I think you have like really severe stenosis. I think you should see, this other doctor. So I did end up going back to the surgeon. He recommended I go to a physiatrist in the healthcare system. I went to him, and I have to say all the doctors were kind and compassionate. I really did experience that. And the physiatrist was very nice. He had MRIs done, and he showed me my MRI, which was quite horrifying to see. Like it was bad. He said your spinal canal is like so narrowed. He said, we'd like to try cortisone injections. He said, not everyone gets relief, but I think you're a good candidate.
And so the spinal canal was narrowed, so they gave you the diagnosis of spinal stenosis, correct?
Yes, that was my my diagnosis. And from the imaging, it looked pretty. I had little pockets of fluid. I had all kinds of things that just didn't look good. Were not encouraging to me, and actually horrified. I was horrified. It was very scary. He was very kind. He was very nice. And let me just backtrack a little. So I've had fear of doctors and medical procedures from the time I was very, very young. And I've done some work on that history, and I think I've identified where that comes from. But I used to just flat out faint. You come near me, I'm just boom, done. And my blood pressure would really plummet. The first time I fainted, I was in school. I think I was in first grade, standing in line waiting to go in. And 2 boys in front of me were talking, and one started telling his friend how he broke his arm. And the next thing I knew, I was inside the school on a couch. I had just hit the deck. And I continue to have trouble with that. Any experience with medicine, medical, something wrong with my body generated so much fear and anxiety that I would just drop out of sight. And my doctor told me I was 50 years old when I got a name for it, vasovagal syncope. And I was like, it's a thing that people get? I thought it was just my thing because, I had already decided that I was a very strange, unusual person and that I would have things that no one else had. So it was really reassuring to hear that. And he said, yeah, you can't help it. It happens. It's not something you can control. And so that was affirming, but it still was an issue because when you faint, you can get hurt on the way down. Sure. And my blood pressure really would go like dangerously low. So it was not something I wanted to experience. So I told the physiatrist about it. I said, just a heads up. And he said, well, we'll give you a twilight sleep. You don't even have to be, we'll make sure that you're not having that experience. And we don't want anyone fainting on the table. So that experience was fine. They were very kind, very compassionate, and which was huge for me. And I didn't have any problems from it. And I felt like maybe the sciatica is better, but I immediately started getting pain in the front of my leg. Okay. Like it just rotated around to the other side. And I remember I was at work at the high school, and I took a step and I was like, holy cow, what the heck? And a whole part of my brain just kind of just went to a place where it said, there's something else going on. Right. This is not just about your body. And I had never heard of mind body medicine or anything, but I just felt like there was a whole nother piece
You just knew. In that
I knew.
moment, you knew it wasn't just a physical issue.
Yes, I knew there was more to the story, but I didn't know what that was.
Yeah.
So I started Googling.
Yeah. No, you had to find it out. And so that's how you people find out about it. And
Yeah.
so what did you find out and how did you learn more?
Well, I remember I was at work and I had a quiet time during my lunch break. And I was fortunate to have my own little separate room that was my safe space. And I started Googling and I came across Dr. David Hanscom's backincontrol.com website because I put in chronic pain that shifts and I put in sciatica pain that moves around. And he had written a book called Back in Control because he is a complex spine surgeon, or was.
Yep.
And so I found his site and it had information on it that just, my brain just went like deep dive into it. And this makes sense to me,
Mhm.
for me, knowing how I am. And I also tick all the boxes for traits of a highly sensitive person.
Mhm. Mhm.
So I am always wanting to investigate and know more and understand better and scope it out. It's just how I am. And so I emailed him. His email was on the site and he responded almost immediately. He was lovely. And he was doing a twice a week Zoom group. This was right before the pandemic hit. So I want to say March of 2020 or late February,
Okay.
because as my memory is kind of clicking in, I had the bilateral injection, the cortisol injection. It was in February of 2020,
Right before.
right before the pandemic.
Yeah.
So this I was doing at work right before the pandemic, and within a few weeks, we were remote.
Right. And what in your memory of that, so leading up to the pandemic and you saw his site and you talked to him, what really struck you? Like what in what he had wrote or you had read really made you start to understand like, oh, this is how it can be more than just a physical issue.
Um, I think a lot of it had to do with the fact that growing up, my father struggled with anxiety, severe anxiety sometimes, that would kind of morph into depression. And he would have bouts of that. And he had tried many, many things throughout his life to address this. But also he would have physical issues that seemed very related to the emotional state he was in. Now, I was a young child, but somehow it like clicked in me, that came back to me, and I realized that I used to have a lot of gastrointestinal issues as a child. And then I would be prone to like ear infections and other things. Like it seemed like, oh, this seems familiar to me. This like emotion and thought and fear, and then these physical kind of manifestations of that. I really didn't, know how to put that together at that time, but I got a sense that
Mhm.
there was a thing there.
Yeah. And so I think you joined Dr. Hanscom's group and we all went remote and we were hiding behind our
Yeah.
computers. And before too long, you reached out to me because you and I met for the first time not long after that in June of 2020.
Yes, because Dr. Hanscom was so forthcoming and so free with his knowledge and expertise, and running these groups twice a week. I got to know other people who were experiencing chronic pain situations and all their manifestations. And he recommended you to me. He said, hey, you're in the Chicago area. There's a fabulous physician who is mind body oriented.
Mhm.
He gave me your name. And the first thing was, does he take my insurance? Like, that was the first thing that popped into my head. And after that, I was like, well, it doesn't matter because I have to reach out to him. And so I did.
Yeah.
And clearly for me, that ended up being a stellar collaboration, because I felt like I really, as we went through that process of exploring what was going on, I learned so much, and you were so encouraging. One thing about me is that I really need to know the science. I don't do woo very well. I just need to know, what is there science behind this? Is there evidence? Are there good studies, not just random studies, but what's happening? And I started investigating Professor Lorimer Moseley in Australia, who's a delight to watch, even in a lecture.
Yeah.
He's just brilliant.
Yeah.
And everything he said, and his research and the way he explained the research, just, to me, was like, yes, this is the thing that I have.
And I think that's such an important first step for almost everybody. And so what I frequently say is, in order to get better, two things have to happen. One of which is you have to understand the science. You have to understand where the pain is coming from. And we, a couple of months ago, opened Cormendi Academy. And so a number of different lectures and videos and lessons about all of this. But the first part of it is Michelle Grimm and I, who's our physician's assistant. We recorded 5 hours of us talking about what we know about pain science, because we think it's that important for people to understand it.
Yes, it was essential for me, because I'm very reality based.
Yeah.
I need to know what's real in the universe I inhabit. And I also recognize that the mind and body are kind of a mystery, but there's science behind it, even if I don't understand it, the science is there.
Yeah.
And I wanted to have a better grasp of how this was impacting me and my experience. And I remember when Dr. Moseley, he did a TED Talk, and he talked about how he was bit in the leg by an eastern brown snake and almost died. But his brain had interpreted that as if it were a scratch from a twig, because growing up, his legs were so scratched up from twigs in the bush that I think his nickname was Scratchy or something like that. And he talked about, how the brain interprets the situation based on your experience, your history, your interpretation of whether, or your brain's interpretation of whether there's danger. Yeah. It's not a conscious process, but he described it as the different parts of the brain kind of working together to determine, do we send a lot of pain or just a little ping, so you can, like he said, kick off the twig and go along your merry way. But then later, he had the same experience walking in the bush, and it was just a twig, and he was floored with excruciating pain, because his brain identified, the last time we were here and this happened, you almost died. I'm sending you serious pain.
Yeah.
And that just blew my mind.
Yeah, right. Because pain isn't about damage, which is how we all think about it, right? We all think that something happens in our body that damages the tissue, and then it sends a pain signal up to our brain, and our brain reacts. But it's really not what the science says. The science says that pain is an appropriate reaction from the brain into the body based on the assessment of danger. And because we're human beings, it's always best to overestimate the danger, at least initially. Better to mistake a stick for a snake than a snake for a stick. And so we're always likely to do that. But over time, we have to recognize what's really dangerous and what's not really dangerous. And so once we recognize that it's just a stick, then we need some way to turn off that process. And that's where I think a lot of people get stuck.
Yeah, we get stuck because, what I learned that was also really helpful is that as your brain responds in an overreactive way to some stimulus, or because of fear, it becomes like a myelinated superhighway, and it becomes very efficient at identifying that sensation and coding it as pain,
Mhm.
when it may just be a little discomfort, a little achiness, whatever. And your brain kind of, your threshold for pain lowers.
Yep, yep,
And
yep.
I felt like that was happening to me.
Yeah.
It was very helpful for me to see the diagrams, to see the research, to hear the explanation, because then once I felt this applies to me, because this is how the physiology of the body and brain work, then I could really move to the next step, which was learning how to retrain my brain to be less afraid and to begin to raise that pain threshold again.
Yeah. And so that was 3 years ago that you and I first talked, and you and Dr. Hanscom first talked. And so
Yes.
what kinds of things have you done since then to help with that process, to help with retraining your brain and decreasing this sensation of pain that you had back then?
Well, when I was in a lot of pain, and then there's another pain element which we'll get to, because I started to have hip pain.
Mhm.
But in that period where I was transitioning from the leg pain, actually, I have to rephrase that. The pain was always in my leg, in my thigh or my lower leg or my foot, but it ended up that it was coming from my hip,
Mhm.
but I did not feel it in my hip.
Mhm.
So it still, to me, was a manifestation of that original sciatic pain that was morphing
Mhm.
and jumping around.
Yep.
But one thing I did learn that is part of the mind-body perspective is that pain will bounce around. It's like playing whack-a-mole.
Mhm.
So it's in one place and then it's in another place, which is good news,
Mhm.
because that means your brain is a very strong participant in your sensation.
Mhm.
Um, and so I had to it was a long process to learn to take what I knew cognitively
Mhm.
and to embrace it somatically and experientially,
Mhm.
because you can know things, but you're still reacting as if you don't know them.
Correct.
That was my experience. So I learned, one of the things I learned is that your thoughts are not always true,
Mhm.
and your thoughts are not you.
Mhm.
But when you're in pain or discomfort or frightened, they feel really true.
Mhm.
And like you said, from an evolutionary perspective, it would make sense to go with that.
Sure.
Better
Sure.
to make, what is it, type 1 error, type 1 error instead of a type 2 error.
Mhm. Mhm.
Because if you make one kind of error, you may end up being something's lunch. And if you make the other kind of error, you've just kind of gone out of your way with a
Right.
little extra effort, but you're not.
Again, yeah, so better to overestimate the danger than
Yes.
underestimate.
Yes.
Sure. And then you were in Dr. Hanscom's group for, I think, a year, and you've done some of my groups and classes, and you sought out a somatic therapist too.
Yes, I did. One thing I think that's really crucial is to allow yourself to separate from all the perceptions of how things work and be open to seeking help and investigating new ways of understanding things you thought you knew. Like the idea of, as Dr. Mosley says, no brain, no pain.
Mhm. Mhm. Mhm.
And that sounds bizarre and ridiculous.
Mhm.
But when you understand that signals come from the body, but it's the brain that determines if there's pain or not
Mhm.
and
Mhm.
generates that, that is a real leap.
And how many times do you think, I ask people this regularly, how many times do you think you needed to hear that before it really sunk in for you at a gut level?
I want to say I probably watched 200 YouTube videos
Yeah.
of Dr. Mosley and other people. I even went to Mayo Clinic to see, is this just an Australian thing with this really entertaining researcher? And Mayo Clinic called it central sensitization syndrome, but
Yeah,
it was exactly the same thing.
absolutely.
So I like to kind of confirm from other sources
Mhm.
that they may give it a different name, but it's the same phenomena. And then I went to Dr. David Clark's work, and just all the people in the field who
Mhm.
have done amazing work
Yeah.
to bring this understanding to the public, because we still have such a structural perspective, that Cartesian model of the brain is here and the body does this, and we're integrated
Yeah.
systems.
For sure. And so the education and the understanding,
Mhm.
are there other things that helped you in this process, do you think? The seeing other people, being around other people, being in the group. What else? What else helped you consolidate this information in a way that was then useful for you?
Well, like I said, I exposed myself to a lot of it. I read a lot of books.
Mhm.
I started listening to podcasts like Nicole Sax's podcast, and I read her book
Mhm. Mhm.
because she explains it in ways that are a little different, but having those different perspectives that all kind of settle on the same truth was really helpful to me. And she also had her own very dramatic experience
Mhm.
with pain and the medical establishment,
Mhm.
and being told that she would never have children and her spine could not support it, and just so many things in her life has just been a complete in complete opposition to all those dire predictions.
Mhm. Yeah.
And that was helpful for me to hear that story, and encouraging and inspiring.
Yeah. And at what point do you think your body started to feel better? Like, how did you start to notice that you were getting some physical relief here?
Well, um I would feel relief periodically, off and on. Like, I remember having a day where I had participated in a class with Dr. Les Aria.
Mhm.
It was like 6 weeks over the summer, and it was wonderful. And one of the things I learned about was kind of pendulation, which is like in a kind of calm, meditative, kind of approach. You would do some somatic tracking, so following the pain, but then if it felt like a lot, then you would focus on another part of your body that had no pain. And then you would go back and you would kind of touch base with it to try to kind of lower that alarm around the pain. And I remember I did that, and I got up and there was no pain in my body for that entire day.
Mhm. Mhm.
And I was like, is is this a thing? Like, am I better now? And the next day it came back. But that was evidence to me
Mhm.
that something, something was definitely going on with the way my brain was creating this experience in my body.
Mhm. Mhm.
But I was also kind of, aware that there might be some physical components, but that the severity of it and the impact it had on my life, that none of that really meshed.
Yeah.
And so I kept working with those processes, and I started investigating meditation and learned that, like, real meditation, like Buddhist practitioners of a certain kind of meditation, you don't have to clear your mind, because you can't clear your mind.
Mhm. Mhm.
And that was fabulous to me. I have a very busy mind,
Mhm.
and
Mhm.
I could just step back and watch how busy it was.
Mhm. Mhm.
And that would be a very good experience. And I didn't have to judge it as, well, that was a failed meditation experience. It
Right.
was just another variety of meditation experience,
Right.
which was really kind of transformational for me.
Yeah.
And that has made a very big difference in the way I observe my experience of experience, if that makes sense.
And I think, as you describe all this, you're describing putting steps in place to gradually decrease the sense of danger about all of this. And the pendulation activity, for instance, is about sort of noticing what's going on in your body, but not reacting to it as if there's an emergency going on, and sort of noticing that there are parts of your body that feel good, and noticing that when you move, pay attention to the parts that don't feel good, that you don't have to jump out of your skin, even though you may feel like you want to at times. And then adding in this meditation aspect where you start to observe your mind and notice the same thing, right? You have a busy, inquisitive mind, but you started to realize that just because your mind's going that fast also doesn't mean there's an emergency.
Right.
So gradually, the sense of danger just in all places, in your body, in your life, in the world, it all starts to calm down. And then as that happens, I think your experience was the sense of the pain starts to calm down.
I felt a difference in that. And also, I became really aware of the narratives that drive us in various ways. I can only speak for myself, but we all have narratives. And there are narratives that come from our family and our personal experience and our self-assessment and our culture and the media and everything. And there is I believe, I'm conscious of it, I don't know if others are, but this kind of expectation that if you're not happy all the time and feeling great, there's something wrong with you. And I had to kind of flip that on its head and go, if I think I'm happy and never hurt ever, then there's something wrong, because I'm a human being having a human experience in a physiological body, a biological, meat suit, as they say. And it's supposed to experience pain and discomfort. Those are just messages letting me know what's going on.
Yeah. Yeah. And so starting to make friends with your body, and what I say frequently is the pain is not the enemy. It's really not. Pain is just giving us information about what's going on around us. And as we learn more and become less scared, then we start to be able to listen to it and learn from it. And that's, I think, when people really start to get a lot better.
Yes, that was huge. And I would say for anyone who's experiencing this, none of this is easy or fast.
Mhm.
What I learned from Kristen Neff's work and others, and from you, because you said if you're beating yourself up, that's not okay. We don't talk to ourselves like that around here.
Yeah.
And I love that, because I did talk to myself like that. And the process of meditation allowed me to start seeing these narratives, and just from a kind of like my favorite Tibetan Buddhist meditator, he always says if you fall in the river, you can't see the river, getting swept downstream by all of that, the thoughts, the feelings. But if you're out of the river, you can see the river. So I would imagine myself sitting on the bank, and rushing past me was all this that goes on. And I saw these narratives about what might happen and how it was going to affect me in a year and what I wouldn't be able to do. And just this whole like storyline that was alarming. And then things to do, like maybe I should call the doctor. Maybe I should get on top of this right away. Maybe. And I could step back and go, ooh, I'm going to let that one just kind of rush downstream. I'm not going to chase it because it's not helpful. But being able to do that, I'm now really pretty quick at catching those. I'm sure I'll do them till I die.
Sure.
But I can catch them and go, that storyline is probably not going to make you feel any better.
Mhm.
We're going to let that one go by.
Yeah.
And that has been tremendously helpful in kind of ramping down, first of all, the need to do something,
Mhm.
and just the sensation of, and I've learned this from my somatic experiencing therapist, just in my body, this feeling of like I'm good, like there's energy coming up, like I need to do something, like a predator is sneaking up behind me and I need to bolt. Like that is the feeling in my body.
Mhm. Mhm.
And I force myself to remain, if I'm meditating, laying down or sitting, to just be like, yeah, you want to run like heck, and we're just going to sit here and see what that feels like.
Yep. A quote I love from a yoga instructor I had many years ago when I was in my 20s is, don't just do something, sit there.
I
So
like,
let's talk about your hip, because that's an important part of the story.
hey,
Also, you learned all this information and you felt a lot better, a lot more comfortable in your body, much less reactive, but your hip never got totally better in my memory.
right. Well, the pain in my leg got more and more severe. It was mostly my thigh, my hip flexor, but I would get cramping in my foot, like it was just the whole leg was, and it was my left leg. My right leg was fine. So my ability to walk, everything was compromised. I was using a cane. At work, I had a walker and a wheelchair. Like it was excruciating. And I did go back to Dr. Koh's office and I said, you guys helped me a long time ago. Can you help me figure out what's going on? Like what is happening? I thought maybe their supportive environment would be the jump start I needed to kind of move past that, along with what I had learned.
Mhm.
And she treated me for about 6 weeks. And I said, I don't think I'm getting better. Maybe some imaging is in order now.
Mhm.
He said, sure, let's do that. So I had a ultrasound on my left hip in 2019 because I was in a yoga class at Dr. Koh's studio. They used to have a yoga class. It was lovely. But I couldn't get my left leg to do to go down. My left leg was up like this, my right leg was down. So I went and they said, oh, you have a little bone spur. It's normal for your age, whatever. Don't force it, but try to keep the muscles limber. Well, it made sense. So I went back and that seemed to be what was going on, but the pain in my leg kept getting worse. And then the sciatica started coming back. Like everything it was that kind of mind body spreading thing because the fear was just coming up. And so she sent me back, and it was the same doctor who had done my bone spur ultrasound. And he started doing the ultrasound, and his face just like literally blanched. And he said, were you in an accident? And I thought, this is probably not good. Probably not good. I said, no, I have not been in an accident. And I said, why? He goes, how did you get here? I said, I drove from work and I hobbled in with my cane. And he said, do you have a surgeon? And I said, what's happening? He said, you don't have a hip left. He said, it's just a mass of fluid and broken bone fragments. And like my hip had become necrotic and the top of my femur was gone. And it was just like this sharp stick gouging a hole in my hip socket. And he said, you have the highest pain threshold I have ever seen in a human. And I was like, on a scale of 1 to 10, it's been about 1,000,000, but I guess I am getting used to it. And he said, no, you need attention immediately. So at that point, I was like, okay, we've gone to DEFCON 5. Like this is a whole different animal. So I did, reach out to, I was supposed to see my rheumatologist because I have a whole collection of doctors now that I'm approaching 65 just to check on things. And when she saw me, she said, "Why are you using a cane?" And I told her the experience, and she said, "Well, I want to do some x-rays, like now." She sent me downstairs this is for x-rays. And then I came back up. It was that fast. And she said, "I want you to see Dr. Ravi Bashal. He's the best. You need a new hip." And I remember telling you about this in a group session.
Yeah.
And I was so devastated. One, because I was trying to avoid surgery.
Yeah.
Because of my fear around that. I thought I'll crash out on the table. Like, I just can't even imagine being able to not pass out in a serious way just in that environment. It was so scary. And I also felt emotionally like I was betraying that hip. That was the hip I carried my babies on, my left hip. There was just so much coming up.
Yeah.
And you really helped me kind of, you said, it's not life-threatening, it's painful.
Yep.
You've gone this long, you can take another couple weeks.
Yes, because in my memory, like, you came and you're like, "I need to have my hip replaced tomorrow." And I was like, "Let's slow down just a second. Tell me what's going on. Tell me the story." And yes, it wasn't life-threatening, wasn't limb-threatening. And so that gave you a little bit of space to do some things and think it through.
And you recommended a book on like pre-surgery, like prehab for surgery. And I also found online meditation and self-hypnosis tracks for surgery, pre-surgery.
Yep.
And one of them was a man who worked with people in the hospital, helping to prepare them for surgery psychologically and emotionally. And his was the best. And I listened to it every morning. It was like 45 minutes long, and every night, and sometimes during the day in that interim before surgery. And you had told me that I can't remember the author of the book. That
Maggie Huddleston is her name. Prepare for surgery, heal faster.
Right, that people healed faster, had less bleeding during surgery, had better outcome, just the whole way better than my default narrative was telling me was going to happen. And but then I learned, not to listen to that.
And then I think this is important also, because I think in my memory, you told me that once the decision to have the surgery was made, right, the relief started then. It didn't start after the surgery.
Yes, that was huge. And that's when I talked to you about, I said, I'm coining the phrase hybrid. I have hybrid mind body because once I saw the surgeon, and he was lovely, and I have learned from you and Dr. Hanscom and others that right from the get-go, I told him I need to talk to you about how I can have a good outcome and what kind of person I am and what I need from you. And if that's not your philosophy or your style as a surgeon, then I need to find someone else. And he sat down across from me and he said, "We've got plenty of time. Tell me what you're thinking." And I said, "I need you to see me as a human being with my emotions and my life and my children and my husband and everything that's happening with me and my wonky hip. But I'm not just a hip. And I know as a surgeon, you're a technician, but I need someone to be a humanist." And it makes me emotional even now thinking about that, because that was so crucial. I knew in my core that if I was going to heal well, I needed to feel that safety I had felt in Dr. Koh's practice. And, he was lovely. And he literally took my hand and he said, we are going to take good care of you. And you are going to be, 2022 was going to be a very good year for you. And it was so affirming. When I left there, my pain had dropped 50% at least.
It's amazing, amazing.
And he didn't do anything. There was no procedure.
Right. So the sense of safety that he created by saying, I hear you, I see you, we're going to take care of you, despite any kind of physical injury was there, dropped the sensation of pain.
Yes. So it was such a confirmation of everything I'd learned, because here, he said to me, I have never seen a hip, or I should say a non-hip, in a patient who's still walking around, even with a walker or a cane.
Yeah.
He said, he said, I can assure you, you have done everything humanly possible to avoid surgery and have tried every possible option.
Yeah.
I'm telling you now that this is your best and only option, and I will make sure that you feel good on the other side.
Yeah. And how did you feel on the other side? How did you feel after the surgery?
I had the most amazing experience. First of all, even going into it, I had no feeling that I was going to pass out. I used the breathing that I learned in doing those meditation and self-hypnosis tapes for 4 weeks, twice a day, every day. And I monitored my breathing to make sure I wasn't starting to hyperventilate. And if something was, I didn't know what was happening, or I asked somebody, I said, I'm feeling anxious about something. Can you explain this to me? And before it could even like take over, it would just be a little hint of, I kind of need to know what's coming next or whatever. I self-advocated, and then it would come right back down. And so I went into the surgery. They did not give me an anesthetic. They gave me a spinal block and a twilight sleep. I have to tell you, I was hearing music and people talking, like I was phasing in and out. I didn't feel anything that you would call discomfort or pain, other than one shoulder. I was kind of like, I want to move that shoulder, like I'm leaning on the shoulder. That was the only thing I remember. And then I was in recovery. But, they want to give you hydrocodone and they want to give you all these pretty strong pain meds post-surgery, because they tell you it's going to kick in and you're going to want it. And I refused the hydrocodone. I never had any pain post-surgery.
That is amazing. And what I said to you and say to my patients is that when people have surgery, almost always they tell me like it's slow, they're frustrated, they didn't realize it was going to be this hard. But people who have done the prehab, people who have read Peggy Huddleston's book and done the meditations and work with their surgical team, they tell me the story you just told me. Nobody can believe how little pain they have. Nobody can believe how well they're doing. Nobody can believe how quickly they're returning to what they normally do. And so it just makes a huge difference.
It was really astonishing. I have to say, when I left his office after that encounter, and I'm with my cane, but I'm like, I just like the pain is down, way down.
Yeah.
And it's like, okay, I know what this is. Like, he did a good job, reducing my anxiety and fear. Really good job.
Yeah.
And I felt confident that all the work I had done, like you said, that I was going to have a good outcome.
Yeah.
And the hospital team, everyone was so lovely. And so like, we're going to take care of you. They kept saying that to me. Don't worry. Right now, your job is to just lay there. We're going to take care of you.
Yeah.
And I was able to surrender that. I'm a bit of a control freak, just a tad.
Yeah.
Been working on it my whole life, but I was able to surrender that. And I literally had no pain. The next day, they sent an OT and a PT to show me how to go up and down. I could not, there's another piece of it. I had to stay off the leg for 6 weeks.
Mhm.
Absolutely no weight on that leg.
Mhm.
Had a walker. And I asked the physician's assistant when she came to check on me, I said, most people are told to get up and start walking fairly quickly. Is there a reason why I have this long lag? And she said, I'm going to have Dr. Bashal talk to you. And he told me, he said, you are the tiniest patient I've ever put a hip in. And it was a good thing we had the computer assistant, the robotic assistant,
Mhm.
because it's tiny in there. And you have very small bones.
Mhm.
And we don't want any potential for fracture in that where it goes into the thigh bone.
Yeah.
He said he said there's so much swelling and inflammation because your muscles were trying to work a hip that was no longer there, so they shrunk.
Yep.
They're
Yep.
all kind of distorted. He said, so we had to kind of rearrange some stuff,
Yeah.
and we just want you to let it heal.
Yeah. And,
And I was like, that's cool. I will not put even a toe on the ground. I
and
got it.
so, and we're going to start to wrap up soon, but one point that I want to explore just a little bit more before we do is, so a lot of people who are watching, right, have learned about mind-body medicine, and part of mind-body medicine is understanding that you're not damaged. And so it turned out for you that there was some damage there, and we needed to address that, and you did. And so people ask me all the time, like, what if I'm injured and I don't recognize it because I'm trying to do this? And so the question would be, do you feel like because you were working on all of this and gaining these skills and learning this knowledge, do you feel like that prevented you from seeing this sooner in a way that was detrimental to you down the road?
You know, I don't think so, because even though they were shocked and appalled that I was able to walk around, I'd been doing it.
Hmm.
And like I said, the pain was all in my leg.
Hmm. Hmm.
So and I had a lot of muscle knots, really big muscle knots, and I would get spasms. So I thought it was muscular,
Yeah.
tendon. I didn't really know what ligaments, but I did not know it was my hip.
Hmm.
But when I finally asked, uh, when I was having those treatments, and I said, you know what, you guys did magic before, but I'm happy when I'm here, but I'm
Yeah.
not improving.
Hmm.
She was very ready to send me to check it out. She said, yes, let's see what's going on in there. So I felt like maybe someone else would have sooner felt like there's something going on. I need to check it out.
Hmm.
But I did not endanger my life or my limb.
Hmm.
I just experienced a longer period of discomfort.
Yeah.
That was really the only difference.
Yeah. And I think also, in various groups that you were in, and, there can be pressure in the mind-body medicine world to see everything through a brain lens as opposed to a body lens. And one of my memories is that, like, you were pretty certain, you worked hard on this, you had made a lot of progress, you had learned a ton, but still these symptoms were there, and you felt like there needed to be further evaluation. And it's interesting because, like I said, people will ask me all the time, what if I miss something? Or give me examples where they feel like something was missed. And in almost all the examples that I hear, people knew something needed attention and other people were telling them that they were okay. It wasn't that they were missing it. It was that the medical system was saying, it's all in your head, or we don't see it, or we don't know what test to run, or everything will be fine. But one of the things that I said, remember about you, is that you knew that there needed to be more evaluation here and you pushed for it, and then
Yeah,
you found
I
it.
was I was
Acted.
pretty sure that had it been what I thought it was,
Mhm.
at that level of safety and what I had learned and what I was practicing, that there might be more going on. And I wanted a confirmation. Now, if I went in and the guy said, yeah, still that bone spur,
Yep. Yep. Yep.
I would have been like, okay, cool.
Yeah. Yeah.
I know exactly what to do.
Yeah.
But there was a part of me going, I really think I would have had more progress by now.
Yeah.
So maybe
And-
there is something else.
yeah. And I'd say, when I see people in my office for the first time, I feel like part of my job is to try to get a sense, like, is there a physical issue going on that's so substantial that you're not going to get better unless it gets addressed? And most of the time, the answer to that is no. I'd say 95% of the time when I talk with people, we make the decision based on their history and my evaluation and studies that have been done and other consultations, that there's no physical injury getting in the way. And sometimes there's a physical aspect there that we need to address. And so now, post-surgery, new hip, all this information, what's your life like now? How do you feel on a day-to-day basis now?
I have to tell you, as you've noted, when I fill out the forms for our group,
Mhm.
my pain is like zero.
Yeah. Yeah.
It's literally, I get up every day and, I still live in a body. I haven't, I haven't transcended to the astral plane. I live in a body and it's going to be 65 years old. So bodies do stuff.
Mhm.
But it doesn't become chronic. To me, you have a twinge here, you have something there. I notice if I get stressed or emotional, I'll get a sciatic pain. And I'm like, oh, my brain still remembers this one.
Mhm. Mhm.
Really good at flipping that switch on.
Yeah.
But I don't go, oh my God, it's back. How long will it last? This is going to be chronic again. Like, I don't, that is the narrative, part of a narrative that my daily meditation practice, and I am not an expert, but I show up every day
Yep. Yep.
and
Yep.
I make a commitment to watch what's going on.
Yeah. Yeah.
And I know that that will take me down a path that isn't helpful. So I can go, oh, there's that narrative again, so persistent. But I'm going to presume that this is just going to move through me and be gone. And it always is now.
Mhm.
And my fear is a chronic condition that is very difficult and impacts your life dramatically.
Mhm. Mhm.
But just normal things that come and go, that's just being human on planet Earth. I don't know how you avoid that.
Yeah, we are all human. We're all having experiences. Our body's going to react sometimes, no matter how much we know. The trick is not to think that that means that there's something wrong when there's not. And to your point, to try to work with your team and me and everybody else to know if is something wrong that
Right.
needs addressing.
And
And
I
so,
think sometimes people have fear, because I understand that.
Mhm.
Fear of, well, if I go and the doctor says, oh, this or that is wrong, one, can I believe him? And two, will I need to do something about it?
Mhm.
And so to continue doing, mind body work,
Mhm.
because you're trying to avoid that, I feel there's a level of fear that is driving your pain anyway,
Mhm.
because you're averse to that other possibility. And what I had to do was embrace that, which was no easy thing for me. Like,
Yeah,
I hope, I was thinking, I hope I maintain consciousness
yeah,
while I'm talking to the surgeon, because I know what happens to me.
yeah, yeah.
It's my body just it's like, we're checking out. We don't like this.
Do
Boom.
you
And I'm
still
on the
get that
floor.
reaction at all? Do you still get that vasovagal reaction these days?
I haven't had it in a very long time.
Mm-hmm.
I mean, I may still be prone, but I have not experienced it. And I've dealt with a lot of things that would have triggered it.
Mm-hmm.
I just don't feel that level of fear and avoidance. It may be like, that's not my favorite thing to think about or deal with, but it's a completely different experience than that need to escape by becoming unconscious, which
Mhm.
was so, it was just like no one was asking me. I would
Right.
just wake up on the floor.
You've managed to take that desire to run, to get
Yes.
away, and you've done enough work that that calms down and you don't need to act on it anymore.
Yes. And it's very affirming, as I'm sure you've seen with so many people.
Yeah.
When you can sit with, what I find is just being able to sit with uncomfortable emotions,
Mhm.
like whatever, grief, sadness, frustration, anger,
Yeah.
and just be there and not need to find a way to make that go away.
Mhm.
But we do live in a culture that doesn't particularly allow those. You're supposed to be happy and cheerful, and then there's toxic positivity where let's look at all the things that are going well and just not think about that. And I found that being like, yeah, I feel sad right now, and there's a reason why I feel sad, and I'm going to feel sad until I don't feel sad anymore.
Yeah. 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 Letting the emotions be.
Runs the course.
Yeah.
Yeah.
And so, all right. And now what? So you live your life, you don't have any pain. What are you doing next month? You want to tell people that?
Yeah. Well, due to the pandemic, I've not seen my daughter or my grandson or my son-in-law in 5 years because they live in Tasmania, and they were shut down for a while. We were shut down, and everyone was afraid to see other people and one thing and another. And the last time they were here, my grandson was 4, and now he just turned 9. It's a big chunk of time.
Hmm?
So my son and his family who live here, and my daughter and her family, and my mother who's 88, who lives in California, we are all going to come together in Maui and have a family reunion for a week.
Hmm.
And I think there'll be lots of big emotions. At least I know I will have a lot of big emotions. So I may have to sit with them, but in a beautiful place with the sound of the ocean. So I'll be fine.
Mhm.
Uh, but and I just retired from 30 years in education, 22 of which were at the high school and special education, the high school I graduated from, my kids graduated from. And so a lot of big life transitions, and
Yeah.
this will kind of be a celebration of everybody being together again.
Yeah. No, that's just awesome. And no pain that you're bringing with you. There's no pain.
So I get up every day, and I can do everything that I did before, and I have very good flexibility. I
Yeah.
can garden. I tend to garden in a squat.
Mhm. Mhm.
So, and I can do that. And
Okay.
I can get up again
Amazing.
from that position,
Yeah.
which to me is like, I'm quite proud of you. That's pretty cool.
It's amazing. Any last thoughts before we sign off this evening for people who are out there and listening and learning and trying to figure out how to move forward?
Yeah, I have great compassion for the experience because obviously I've experienced it. And I know how overwhelming it can be. And the thing that I would say is, one, be kind to yourself and be patient. Uh, don't be afraid to check things out if a little niggling voice in your mind is saying, oh, there might be more. Because if there is, you want to deal with it like I did, which got me to the other side in really good form,
Mhm.
and quickly. I had a very good recovery.
Yeah.
Um, and if it turns out there is nothing, then you have more confirmation to carry on your mind body work with confidence, and that will bring the fear and anxiety down. So I would say it's really important to check things out with a physician that you trust and that makes you feel safe. I
Yeah.
would say advocate for yourself to
Yeah.
find someone.
And you also, you've had that niggle in both directions. That's how you got started with all of
Yes.
this, is that little niggle, like something else is going on here too, that moved you this direction and that direction, and sort of the some combination as you
Right.
go through life.
It's a difficult journey.
Mm,
I would say you just put one foot in front of the other and show up every day. And for me, it's very important to, like you see, you corrected me, outcome independence. I
mm,
was outcome dependent.
Yep,
Outcome independence
yep,
is huge because it allows you to be present in the moment and just be proud of yourself that I'm showing up today. Maybe I'm going to do 2 minutes of a mindfulness meditation. Good for me. I
yeah,
showed up for myself today. Whatever it is, allow that to be what it is and celebrate it. And it's very difficult to not have that goal orientation. It's what we learn to do in this culture very early on. And it's hard to abandon that. But in this case, it is really helpful to just be there in the moment,
mm,
do what you're doing, be proud of that, and move forward one step at a time. I felt that that really worked for me.
yeah. So thank you, Linda, so much for being here and talking about this and sharing your story. I know how much it means for everybody who's listening to be able to hear this and hear that people start in one place and are able to move through and come out in another. So thank you for sharing your insights and your story and your experience.
Oh, you're very welcome. And I hope that whatever I may have said that made someone feel a little bit safer and a little bit more hopeful, that they will take that and show up for themselves.
Absolutely. Absolutely. And for those of you listening, as I mentioned before, if you'd like information about working with me or our team here at Cormendi, you can contact us through our website, cormendihealth.com. Our staff will get back to you with everything that you need to know. And thank you to each and every one of you. Also, every time we record, every time we talk about this, I'm reminded every single time about how blessed and touched I am to be part of this community of people who are working so hard to find healing in brave and creative and cutting edge ways. And until next time, good night, everybody, and take care.